short didn't work, but I think the shorter one would have worked, but at this point we're not changing it.
Okay, all right, so let's go over this.
So the first thing is when he's sleeping, you should kennel him. Do you have a kennel?
He can't like go full circle. He can move around, but it's
Okay.
a tight fit.
Okay, so I would keep him kennel except when you have him out for stuff. I don't want him playing with this on. I just, as much as possible, I want him relaxed with this on. So when you do have him in the kennel, you can actually leave this outside the kennel so he doesn't mess with it.
Oh, okay.
The line is plenty long enough, and he's gonna have to that e-collar on so he doesn't chew it out at the over here. If he does chew it out, I need you to bring every single piece into us so we can see if it's intact or if he has some still in his bladder.
Okay.
So you can just loop. I'm making small loops this time. The last time I made bigger loops. So you just loop all of that. And then this is the line that comes in the bag.
Mm-hmm.
You take it, you pass it through the loop and around his belly. I
It's
know.
okay, baby. It's okay.
And then your other end has the button on it. And you can just snap the button closed, and this way all your loops are caught in there. You can fold this bag in half, tuck it under here, and now he is completely tucked up, good to go. Those loops don't always stay perfectly looped, so I just like to have the stuff on top of him so if it's hanging low, he doesn't get his foot caught on one of those loops. For your 24-hour care, do you have betadine or just a basic?
No, I don't have any.
You can use the alcohol wipes for the catheter itself. It's just usually every 24 hours we take just a little betadine on a cotton swab or a little bit of gauze, and we just wipe around his prepuce just to keep that area clean. But then you can just take plain old rubbing alcohol and just wipe the line from him to the bottom.
Okay.
That's all it is every 24 hours just to keep this.
Do you have
clean.
a small betadine that I could take for just till tomorrow morning? Then I can just take some in the hospital tomorrow.
Yeah, I can do that, absolutely.
I have a shift tomorrow, so.
When you're emptying his bag, this part down here, it's just an open close. You open it, hold it up, drain it into a bowl or whatever you're doing, and then just close it again.
We don't need to keep track of his output, do we?
I don't think so.
Okay.
It should be, if you want to do the measurement, it's 1 mil per kg per hour is our normal urine collection. We here collect about every 4 hours. So for a kid of his size, would that be like 120 to 150 mils of fluid? Probably a little less because he's not on fluids like most of our kids are. But you're probably going to be collecting them less than every 4 hours because I don't expect you to wake up in the middle of the night to collect them.
Yeah, no.
So you can kind of just go from there. If you do it every 8 hours or so, just kind of expect to see maybe around 200 or so. I'm not worried, as long as he's eating and drinking and otherwise acting normal, I wouldn't worry about it unless you're not seeing any. That tells me that this system is, maybe we got some crystal sediment or something in there that's potentially clogging it. So then what you would do is this port right here, you would just take a syringe of saline, you can pick those up at work.
And try and
I pinch
flush
the
it.
bottom, flush it through the catheter and see if maybe there's just something in there what's clogging it a little bit.
Okay.
And that's what we do all the time regularly just to see if maybe that's why I haven't gotten any urine back. But I wouldn't expect he'd have a urinary issue. I would expect if you're not getting anything, it's probably clogged.
Okay. So he needs to be in a kennel.
Yeah, just because if he
'Cause we have
steps on
another
this,
dog
if
at the
he
house,
pulls on
too.
it, it's going to, you may get a little bit of blood in here. Sometimes it just happens if it gets pulled on a little bit, so don't be too surprised if that happens. But also, if we keep it attached to him like this, it's not going to have good flow. And so to keep good flow, you need to have it on the ground. And so the best way to do that without him constantly pulling on it or dragging it around is to keep him kenneled.
Okay. All right.
Right now he's a little drunk, so he probably won't mind too much right now. He's had midazolam and hydromorphone, so
Will he get sick at all?
he shouldn't. The
Any side
hydro,
effects?
Yeah, the hydro can cause panting and it can cause some increased GI motility for short term. I think he's past that point, but I think the midazolam kind of evened everything out, so he's just going to be sleepy.
All right. So, is there a side effect I should be worried about or watch for from the meds or
No, those will be out of the
symptoms?
system
They'll
by
be
tonight.
out.
Yeah,
Okay.
the hydro only lasts 4 to 6 hours. Midazolam, I want to say like 90 minutes. It doesn't last that long, so he might be a little sleepy tonight, but it shouldn't be a big
My
issue.
poor boy. I'm sorry. We're gonna go home. I'm gonna
Poor
get
thing.
you
It
in
was
a kennel.
it was tough. There was definitely a big old stone in that urethra that was really hard to get past.
I
so
heard.
We were,
Is he in
luckily,
pain? Should I give him anything
the
for
hydro
pain?
is a great pain control. It's an opioid, so
Do I need to give him anything for
you
pain?
shouldn't, because like I said, that one lasts about 4 to 6 hours, and the only painful thing was the initial just irritation to his urethra. It shouldn't be a continued issue, so I can ask the doctor if he wants to send anything, but I don't think at this point he necessarily needs it.
Okay. All right. So I'll get him home, get him in his kennel, and let him go outside if he has to go to the bathroom, but try and keep him in the kennel
Correct.
until surgery.
Correct. And then anytime you have him out and moving, just do this so we don't get any pulling on it, but anytime he's in the kennel, detach
Right.
it so it can just lay on the ground.
Otherwise, can he like jump on her bed and lay on her bed, or do you prefer
He can
limit
jump
it?
up on stuff, but if he's doing that, this has to be up like this, which means it's not draining. So
Then
just every
yeah.
time he's up and going somewhere else,
So
this
then
essentially
the
isn't
catheter's
draining.
not right
Yeah,
because
and
the
it's
gravity
okay,
he
you
needs
know,
that
like
low.
it can take a few hours. It's not like he's not used to holding it. He doesn't constantly urinate at home. It's just giving him a chance, especially overnight, stuff like that. Giving him a chance to let it drain is the best.
Okay. All right, Ozzy baby.
Okay.
We're gonna go
Sweetie, I
home.
gotta see which one of these is gonna be appropriate.
Come here, baby.